Hey there, and welcome to today's video. I'm your host, and I'm excited to dive into a fascinating topic that affects all of us: the surprising link between our oral health and our heart health. That's right, the health of our teeth and gums can actually have a significant impact on the health of our hearts. Now, I know what you might be thinking. How can my mouth possibly be connected to my heart? It's a great question, and one that researchers have been exploring for years. The truth is, there's a growing body of evidence that suggests poor oral health, particularly gum disease and tooth infections, can increase our risk of developing cardiovascular problems like heart disease and stroke. But before we get into the nitty-gritty of how this connection works, let's take a step back and talk about what we mean by poor oral health. Essentially, this refers to any condition that negatively impacts the health of our teeth, gums, and mouth. This can include things like cavities, tooth decay, gingivitis, which is inflammation of the gums, and periodontitis, a more severe form of gum disease that can lead to tooth loss. So, how common are these oral health issues? Well, according to the Centers for Disease Control and Prevention, CDC, nearly half of all adults aged 30 and older have some form of periodontal disease. That's a staggering number, and it highlights just how important it is to take care of our oral health. But what exactly is the link between oral health and heart health? Well, there are a few theories. One is that the bacteria that cause gum disease can actually enter our bloodstream and travel to other parts of the body, including our heart and blood vessels. Once there, these bacteria can trigger inflammation and damage, which can lead to the development of cardiovascular problems over time. Another theory is that the inflammation caused by gum disease can also contribute to inflammation throughout the body, including in our blood vessels. This chronic inflammation can damage the lining of our arteries, making them more susceptible to the buildup of plaque and increasing our risk of heart attack and stroke. Now, it's important to note that while there is a clear association between poor oral health and cardiovascular disease, we don't yet know for certain whether one directly causes the other. It's possible that there are other factors at play, such as lifestyle habits like smoking or poor diet, that contribute to both oral health problems and heart disease. That being said, the evidence linking oral health and heart health is compelling enough that many health organizations, including the American Heart Association, recommend maintaining good oral hygiene as part of an overall heart-healthy lifestyle. So, what can we do to keep our mouths and hearts healthy? Well, the good news is that many of the same habits that promote good oral health also promote good heart health. These include brushing our teeth twice a day with fluoride toothpaste, flossing daily to remove plaque and food particles from between our teeth, eating a healthy diet rich in fruits, vegetables, whole grains, and lean proteins, avoiding tobacco products, which can damage our gums and increase our risk of both oral and cardiovascular disease, visiting our dentist regularly for checkups and cleanings. By making these habits a regular part of our routine, we can go a long way towards protecting both our oral and cardiovascular health. Now, I know that some of these habits can be easier said than done. Trust me, I've been there. But the key is to start small and build up over time. If you're not in the habit of flossing, for example, try starting with just a few teeth each night and gradually work your way up to your whole mouth. And if you're struggling to eat a healthier diet, focus on making small swaps, like choosing whole grain bread instead of white, or snacking on fresh fruit instead of candy. Remember, every little bit counts when it comes to our health, and even small changes can add up to big results over time. So, what should you do if you're concerned about your oral health or your risk of cardiovascular disease? The first step is to talk to your healthcare providers. Schedule a checkup with your dentist to assess the health of your teeth and gums. And don't be afraid to ask questions about what you can do to improve your oral hygiene routine. If you have a history of gum disease or other oral health problems, it's also a good idea to let your primary care doctor or cardiologist know. They can work with you to assess your overall risk of cardiovascular disease and recommend lifestyle changes or treatments to help lower your risk. In some cases, your doctor may recommend additional testing or monitoring to keep an eye on your cardiovascular health. This might include things like regular blood pressure checks, cholesterol screenings, or even specialized imaging tests to look for signs of plaque buildup in your arteries. The bottom line is that taking care of our oral health is about more than just keeping our teeth and gums healthy. It's about protecting our overall health and well-being. By making good oral hygiene habits a priority and working closely with our healthcare team, we can lower our risk of developing serious health problems down the road. So let's recap what we've learned today. There is a clear link between poor oral health and an increased risk of cardiovascular disease, although we don't yet know for certain whether one directly causes the other. The bacteria that cause gum disease can enter our bloodstream and trigger inflammation and damage in our blood vessels and heart. The inflammation caused by gum disease may also contribute to chronic inflammation throughout the body, which can damage our arteries and increase our risk of heart attack and stroke. Maintaining good oral hygiene habits, such as brushing twice a day, flossing daily, eating a healthy diet, avoiding tobacco, and visiting the dentist regularly can help lower our risk of both oral and cardiovascular disease. If you're concerned about your oral health or your risk of heart disease, talk to your healthcare providers. They can work with you to assess your risk and recommend lifestyle changes or treatments to help keep you healthy. I hope this video has helped you understand the important connection between oral health and heart health and has inspired you to make your oral hygiene a priority. Remember, small changes can add up to big results over time, so don't be afraid to start small and build up from there. Thank you so much for watching, and until next time, take care of yourselves and each other. Bye for now.